Brynham Dar, everybody, and croeso and welcome. This afternoon we have an extraordinary public board meeting and a warm welcome to those members of the public who are looking at the meeting on live stream. The main reason for this meeting is to approve our annual recovery plan and to receive our programme business case for delivering our strategy. And I'd like to reassure members of the public that the board has met on a number of occasions during the process of designing and agreeing what should go into these plans and the business case, so that if the meeting is quite short, it's because we have given it many hours of consideration and scrutiny prior to this meeting. So I'm going to go straight to the agenda. We have apologies from Lisa Gosling, Donna Coleman and Mantle Bennett from the Community Health Council, and Helen Williams is attending on their behalf. So welcome, Helen. And we've also had apologies from Hashim Samia, who is the Vice Chair of the Black and Asian Minority Ethnic Board Advisory Group. Do we have any declarations of interest? No, thank you. Okay, so we're going to go straight on to our assurance, and it is the Hywel Dda University Health Board's Annual Recovery Plan 2021-22, and I'm going to ask the Chief Executive, Steve, to do a short introduction.
Thank you, Chair. And yeah, I'm really pleased to be presenting this to Board today. This is our annual plan, our plan for recovery. After an unprecedented year, this is going to be our first plan on how we're going to start moving forward as an organisation. There are three, I think, key parts to this for me. Part is the rebuilding work that we are embarking on to recover what was lost. I think importantly, recognising the enormous sacrifices, the professionalism, the perseverance and the kindness of our staff, and actually start to build a positive legacy coming out of the other side of this pandemic. Above all, it's for me about how we start to look forward with some optimism and, as I say, build a positive legacy of what's been an unprecedented year for everyone. I guess unusually, and Lee will say a little bit more about this, however, this plan should be viewed actually just as a start of our recovery. There still remains so much uncertainty ahead. You know, we are in a very tight race now between the vaccination programme and the virus, particularly driven by the Delta variant. And as such, we're going to need to maintain that sort of flexibility that we've seen over the course of the last year, recognising that there's a very fluidity to our current situation. But as we've done for the last year, we will ensure that the board is kept informed and is able to direct any changes during the course of this year. So I'm therefore seeking board support for this plan, which every exec has played their part in committing to, and that we will continue to bring back updates as and when the situation changes throughout the rest of this year. So I'm going to hand over to Lee, with your permission, Chair, to give us a brief overview.
Thank you, Steve. Lee.
Thank you, Stephen, and thank you, Chair. So, as Steve says, really pleased to bring forward this the annual plan for board approval prior to submission to Welsh Government by the end of the month. As you said, Chair, an earlier draft of this plan has gone through the board, and we've had a series of discussions since that point as well, reflecting on feedback we've had from Welsh Government, and naturally our plans have been developing over the last couple of months as well. There are, I guess, two key elements for us to describe in this plan. One is the continuing need to respond to the pandemic and what that requires of us over the forthcoming 6 to 9 months in the first instance, and then potentially beyond. And then secondly, starting to set out how we intend to recover from that, bearing in mind, as Steve has said, the toll that is taken on both the population and the health of the population, but also of our staff. So this updated plan did go to board seminar last week. We had a thorough discussion about it. We've made some amendments to reflect the comments from board members at that session, so that was extremely helpful from our point of view. The feedback we have had, and is shown in the presentation, has been consistent from Welsh Government and internally around need to triangulate some elements of our plan, service, workforce and finance, but also to provide some greater clarity on the key deliverables and timeframes for those deliverables. So we have, you'll note, amended the plan to reflect that, including some yellow boxes under each of the planning objectives to clearly set out what we intend to deliver and over what time frame. The other element that we have adjusted is we were aware that the main plan that we produced was significantly longer than that requested by Welsh Government, and therefore we have produced a shorter summary version, which is also with your pack today. So one thing I'd just like to draw out is obviously the use of strategic objectives and planning objectives. That's becoming a much more common currency for us now as a health board member, and they form the basis of the plan that you have in front of you today. The board will also be aware that a great deal of work has been done to develop the board assurance framework, which I know is subject to a separate discussion, and the performance measures then to enable us to track both the risks and then the impacts of the planning objectives that we're looking to deliver over the forthcoming months and years. So the slides in the pack do provide some further details then on the updates since the March plan. I don't propose to go through those, but obviously welcome any questions or comments on that. And then the final point is that this is a planning cycle, so we are already looking ahead to what we need to do for 2022, 2023 and beyond. I have my first meeting on that tomorrow with the team to really think about how we start to set out our approach to developing our approach to planning more fundamentally, but then secondly, specifically the IMTP that we're looking to develop, or the integrated medium-term plan we're looking to develop ahead of next year, which our objective is to seek approval of that, or to produce an approvable plan for submission to Welsh Government towards the end of this calendar year. So I was going to stop there, if that's okay, Chair, and invite any comments or questions.
Thank you, Lee. Thank you very much. I'm going to open it to members. Do they have any questions or comments? Just raise your hands.
Okay, sorry, can you pop it in the chat bar if you want to come in, because the hand function doesn't work.
Okay, thank you. There are no. Oh, here we go. Helen, could you come in?
Yeah, I just wanted to see, I read, and I didn't read the whole document, so I could have missed it, but how your winter plan, then I can't see that in your recovery at all, and there's no reference to it. So I was just wondering how you triangulate your winter plan, really.
That's just Andrew picks that up, Lee.
Andrew, would you like to come in, please?
Yeah, just trying to turn the camera on even. There we go. Sorry about that. Yeah, no, so I think in terms of the winter plan, I mean, in terms of the plan, the core, if you look at what the actions we took last winter and the actions that we're articulating in there in terms of the county plans and the unscheduled care, urgent emergency care plan, actually you'll see a lot of correlation and alignment between the two. So I think we're trying to, the urgent emergency care response and development of that model that we talk about is very much the core and at the heart of our, would be very much the heart of our plan for the coming winter. There are always additional actions we take on top of that around the days that we identify as being the most pressured demand wise, or potentially in terms of flow constraints, and we would look to be we'll be looking to put additional resource around that, whether that's additional senior decision makers or nursing input at various points in the pathway. But I think very much the core of our plan is what's articulated there. We're not clear yet whether it's not clear yet whether we'll be asked to submit a further plan for winter, and I think some of that is tied into the uncertainty there is still nationally around some of the demand modelling for what happens next in the pandemic and what the wider impacts might be for our non-COVID demand as well across the system and across all parts of the service, including paediatrics.
Thanks, Sandra. I'm going to bring in Steve as well.
Yeah, just to build on that, thanks Andrew. I guess there is probably going to a fairly strong expectation, Helen, that there will need to be a standalone kind of addendum to this plan going into the winter. However, the gold command requirements that are set out in this plan are based on our best modelling to date on what we think peak demand will look like through the winter, the 945 bed plan. I think the reason why we're likely to need a standalone plan is part, as Andrew said, there are uncertainties ahead, particularly in relation to flu and RSV in children that we are currently working on, which will require specific responses in our paediatric services and in our sort of frailty services. So I think this plan you can see as an overarching plan for the year, but there will be further detail that will need to be put in place once we know some of those planning parameters a little better, which probably goes back to what I said at the beginning around the fluidity of the year that we're in.
Yeah, thank you. Thank you, Andrew. Thank you, Steve. I'm going to bring in Judith, please.
Thank you, Chair. First of all, if I could just echo what's been said to thank everyone who's been involved in developing this plan. I think it's a really good document, so congratulations, and I guess congratulations to Lee, who's done so much work in such a short period of time since he joined us. I also want to echo what you said, Chair, about recognising the work the staff have done over this last year. I've never known anything like it. I've been in the NHS a long time, and I think everything we can do to support them to recover so they can help the services to recover is really welcomed. I'm glad that features so highly in the plan. I'm also very delighted that there is so much focus around out of hospital, about the developments in community and primary care. My question is a minor one, but relates to that, and it's just seeking assurance that the primary care workforce and the GP workforce as part of that will be part of the overall workforce strategy in the longer plan going forward.
Thanks, Judith. I can bring in Lee.
Chair as well.
Okay, and Tracy.
Yeah, she's representing Lisa, Chair.
Tracy, do you want to come in first?
Happy to, Chair. So in terms of that question, there is an awful lot of work going on in the background, Judith, around the primary care workforce and workforce planning specifically around the multidisciplinary team in primary care and alternate practitioners that we could draw in, particularly around the urgent primary care work. And I think it's fair to say that as a health board, we do not employ the medical and the dental or the workforce in general in primary care. But we do work closely with HIW in terms of the education and commissioning to influence what that might look like. And there are a number of national pieces of work around workforce planning and training and education for the primary care workforce that we are seeking to bring into the health board and working very closely with Rhian Bond and colleagues around primary care.
Thank you. Thank you, Tracy.
If I could bring in Hugh, please. You wishes to comment.
Diolch, Cadeirydd. Just a couple of things on the finance plan, which clearly has been through a change since the original plan that came to board, and I wanted to bring the board up to speed on what's happened in the meantime. And just for assurance, we have had a number of discussions with the Finance Committee on this. But if you recall, at the last iteration of the plan, you were presented with a deficit for the year of 57.4 million, and that was because we built in the savings that hadn't been delivered last year because of COVID into our underlying deficit at that point of 25 million, and that made it the 57.4. So now in discussion with Welsh Government, there has been an agreement that across Wales that those savings not delivered last year would be funded again this year. There's a degree of due diligence needed through Welsh Government, so I can't confirm the figure that they'll allocate to us as yet, but our figure, our savings that we didn't deliver was 32.4 million that we're seeking funding for at this stage. So having assumed in our plan now that we will receive that funding, the plan now is restated to that 25 million figure. The underlying deficit hasn't changed. This is another in-year allocation at this stage, and that's something that we need to consider in our planning round for next year. Chair, just wanted to update the board on that.
Thank you, Hugh. Are there any other questions or comments from board members? John.
Chair, if I just may comment that discussions that we've had at PPAC with regards to this plan and the objectives within it, it's good to see that those have now been reflected in the updated version, particularly around the workforce and the section on the workforce. So I guess is to reassure a board that subcommittees have equally scrutinised this document and welcome the approach that the board is taking.
Thank you very much, John. Gareth, would you like to come in?
Yes, please. Thank you, Chair. Again, I reiterate and I totally agree with all the comments that have been made, and particular thanks to Lee for the way he's presented this, not only today, but in the great detail that we've had it presented at board level. I'd just like to draw the point actually on, as far as the public are concerned, if they focus on anything, to focus on the plan on a page, which I think those 2 pages there set out very clearly the ambitious nature and the scale of the task in hand. But it's a superb document as it says, on a page, to keep track of the huge agenda ahead of us and the anticipated timescales so we can monitor progress. So those 2 particular pages there, I think, are critical to actually for people to understand and to keep track of the pace of the change that will be inevitably occur over the next few years. Diolch yn fawr, thank you.
Thank you, Gareth. Diolch yn fawr. And I totally agree. It's really important that we communicate clearly and simply and plainly what we are proposing to do as a board, so everybody can understand it rather than it be buried in very long documents. So thank you. Ewan.
Yeah, Pranam Da, good afternoon everyone. Again, echoing colleagues' comments, huge thanks for the production of this really valuable document. Just wanted to kind of pick up really in terms of really welcome the emphasis in terms of the heading, helping strong communities. And again, the reference to working in partnership and looking to commission applicable organisations from across the third sector to support colleagues within Hywel Dda in terms of their engagement within and for our communities. So it's just really to kind of highlight, I suppose, in terms of there are various different mechanisms by which to engage with those third sector organisations. And it's just to make sure that as an organisation, we look at all different outlets to engage with those people who I know I've mentioned before. For many in our communities, those community-led organisations are the first sector rather than the third sector. And I think, again, huge contribution they can make to support Hywel Dda in terms of its continued programme of supporting our population across the 3 counties.
Thank you, Diolch yn fawr, Ewan. I'm going to now ask the board, are they happy to approve the annual recovery plan and approve its onward submission to Welsh Government? Thank you. And can I reiterate the thanks to Lee, who's recently joined the organisation and has produced this document with his team. And thanks to all the executive and all their teams for all the work that has been done over many months to put together what we believe as a board is a viable and an ambitious recovery plan. And particular thanks for the focus on staff within this, who have been phenomenal over the last 18 months. A lot of self-sacrifice, dedication, commitment, and also reiterating what Ewan said about the third sector or the first sector, who have kept people safe in our communities in an incredible way over the last 18 months as well. And we must continue to work together as we have specified within our plan. So thank you, everybody. So we'll now go on to the next item on the agenda, which is the board assurance. Yes, the board assurance, please.
Chair, I can be relatively brief with this, although the board secretary, who has been the controlling mind behind all this and the inspiration, may want to say a few things. But I guess all I would mention is I think this document is going to be really important to ensure the board continues to navigate against those 6 strategic objectives, that we're making the progress that we hope we're going to make in the plan that we've just set out. The work that Jo and her team has led, I think, has been fantastic. I think I've said in private session before, but I'll say it in public, I've never been so excited about a board assurance framework. Never thought I'd say that. I guess the only point I would want to make before asking Jo for any comments is to recognise that this is because this is so important. This is a starting point for us, and actually there's going to be a lot more development of the board assurance framework, not just through this year, but I think in the long term. And I think it'll become a really important tool to enable the board to be looking at that far horizon that we've set ourselves, whilst the exec team and our organisation get on with delivering on those planning objectives that hopefully move us in that direction. So I don't know whether the board secretary wants to add in.
Thank you, Steve. I think just to add, really, just to thank exec colleagues that have worked really closely with us over the summer to develop the risks. So you can see the draft risks that are there for members. There's a lot more work to do, in particular now to design the measures. So in order that you'll be able to see whether we're on track with delivering the strategic objectives. And we have got a plan by September that we should hopefully then start to see a difference in how the board agenda is written as well. So you can see the here and now, as well as the longer term visions that enables the board to discharge its duties. So just happy to take any questions, Chair.
Thank you, Jo, and thank you, Steve. Are there any questions? Okay, is the board happy to agree the above approach to managing the BAF, recognise the next steps and note the principal risks that have been identified to date? Thank you. And I just want again to say thank you to Jo and all the execs who've worked on this. I think we are, as a board, going into a different stage of maturity by having our strategic objectives, our planning objectives, and a board assurance framework that, as you say, we can monitor the progress in the most effective way. And I think it's really important for us, the board, to have this discipline and maturity. So many thanks. Some lovely comments there, Jo. Excellent document and well done.
So thanks, Charlotte. Charlotte's been the inspiring mind behind this, to be fair.
Well, please thank Charlotte on our behalf as well. So the next item on the agenda is the programme business case, delivering our strategies, the implementing the healthier Mid and West Wales strategy. So I go straight to Lee. Thanks, Lee.
Thank you, Chair. Yes, so this is an important update on the planning work that we've been doing in respect of the business cases to support the implementation of our strategy, Healthier Mid and West Wales. The update that you've got in front of you today begins with a reminder of why we've set out on this path, most notably concerns around the sustainability of the current model, ageing and poor quality infrastructure, and the impacts that both of these can have on the patient experience and of course the quality of care received. On the reverse of that, what we expect is that the delivery of our strategy will support a shift in the way we deliver services, so closer to home. It'll modernise our buildings, and it'll also help us in our wider objectives to improve recruitment and to support our ambition to significantly reduce our carbon footprint. And lots of opportunities that flow from each of those statements. So the update in front of you gives you a high-level summary of the actions and the tasks being completed over the recent months and where we are against each of these. In particular, it draws out the update on the engagement work, which actually closed earlier in this week. So the updated position is we've had nearly 2,500 visits to our website in relation to this, with this specific item, which is very encouraging given we are trying to engage during a pandemic, which could be difficult. And we have had 268 completed surveys from members of the public, of which the majority want to be kept informed and remain engaged with the process, which is very pleasing for us. There is a specific reference to the land and our plans around the land. So the board will note that we have requested nominations from the public as to potential suitable sites. We have had 7 nominations to date, and you'll see within the pack the process that we intend to follow to reduce that to a long list, a short list, and then to reach a definitive decision during the middle of next year. One thing to say on that is we are committed as a health board to engaging the public fully in the site selection to the extent that it's likely that we'll have a majority of the public participating in that process. So as in a majority of the group taking on that task. So we're going to take that through our executive team and through board subsequently, so people are clear on that process. But that is our intention at this point. So that was all I was going to add in terms of the where we are. I think the update is fairly self-explanatory, but if there are comments and questions, again, we've discussed this at board seminar recently, but if there are comments and questions, happy to receive them. Thank you, Chair.
Many thanks, Lee. And there is a comment in the sidebar from Helen from the CHC to say that Nicola and the team did an excellent job on the engagement, and that's really, really important. So thank you. I'm going to open it for comments, questions. Yep, Steve.
Just one thing to kind of add to this. It's a piece of work that's going on in the background, but I think I may have mentioned at the board seminar, but we're in the process of developing the design principles which will underpin the building of the new hospital and the redevelopment, the repurposing of Withybush and Glangwilly. We're doing that linked to our strategic objectives, so a direct flow through with measures attached to them. And the reason for that is, whilst I chair the PVC steering group, it will enable the board to become the conscience of the delivery of the strategy, to be able to see that overall it's delivering on its strategic intent. So there's a bit more work to do on that at the moment, but we will bring that back in due course for board consideration, and then we'll be able to use that as a way of updating the board and keeping that assurance.
Thank you, and thank you, Steve. And you know, one can't underestimate the meaning of that word, conscience. It's really important that there is an independent